Which type of white blood cell is primarily responsible for producing antibodies? Option A, neutrophils. Option B, lymphocytes. Option C, monocytes. Or option D, eosinophils. The correct answer is option B, lymphocytes. Explanation. Lymphocytes change into plasma cells, which produce antibodies to fight infections. Other WBC types do not make antibodies. Which blood cell is responsible to transport oxygen? Option A, leukocytes. Option B, lymphocytes. Option C, platelets. Or option D, erythrocytes. The correct answer is option D, erythrocytes. Explanation. RBCs, erythrocytes, contain hemoglobin which binds oxygen in the lungs and releases it to tissues. Which blood group is known as the universal donor? Option A, AB positive. Option B, O negative. Option C, AB negative. Option D, O positive. The correct answer is option B, O negative. Explanation. O negative blood has no A, B, or Rh antigens, so it can be given to any patient in emergencies. Which is the most abundant plasma protein? Option A, globulin. Option B, fibrinogen. Option C, albumin. Option D, prothrombin. The correct answer is option C, albumin. Explanation. Albumin maintains osmotic pressure and transports substances in the blood. Which WBC type is the first to respond to infection? Option A, lymphocyte. Option B, monocyte. Option C, neutrophil. Option D, eosinophil. The correct answer is option C, neutrophil. Explanation. Neutrophils are the most abundant WBCs and act quickly to engulf bacteria, phagocytosis. Which vitamin is essential for blood clotting? Option A, vitamin A. Option B, vitamin D. Option C, vitamin E. Or option D, vitamin K. The correct answer is option D, vitamin K. Explanation. Vitamin K is required for the synthesis of clotting factors like prothrombin. Platelets are formed from option A, megakaryocytes. Option B, monocytes. Option C, lymphoblasts. Or option D, erythroblasts. The correct answer is option A, megakaryocytes. Explanation. Platelets are fragments of large bone marrow cells called megakaryocytes. Normal platelet count is option A, 50,000 to 100,000 per cubic millimeter. Option B, 1 lakh to 1,50,000 per cubic millimeter. Option C, 1,50,000 to 4 lakhs per cubic millimeter. Or option D, 4 lakh to 6 lakh. The correct answer is option C, 1,50,000 to 4 lakh per cubic millimeter. Explanation. This range is necessary for normal clotting. Lower counts increase bleeding risk. Which condition is caused by deficiency of vitamin B12? Option A, aplastic anemia. Option B, iron deficiency anemia. Option C, pernicious anemia. Or option D, sickle cell anemia. The correct answer is option C, pernicious anemia. Explanation. Lack of vitamin B12 leads to megaloblastic anemia, commonly pernicious anemia. Which ion is essential for blood clotting? Option A, sodium. Option B, potassium. Option C, calcium. Or option D, magnesium. The correct answer is option C, calcium. Explanation. Calcium, factor IV, is required in multiple steps of the coagulation cascade. The process of stopping bleeding is called option A, hemolysis. Option B, hemostasis. Option C, hemopoiesis. Or option D, hematuria. The correct answer is option B, hemostasis. Explanation. Hemostasis includes vasoconstriction, platelet plug formation, and clotting. Which blood component helps in immunity? Option A, RBC. Option B, plasma proteins. Option C, platelets. Or option D, fibrin. The correct answer is option B, plasma proteins. Explanation. Immunoglobulins, antibodies, in plasma fight against pathogens. Which condition is caused by abnormal hemoglobin structure? Option A, hemophilia. Option B, sickle cell anemia. Option C, thalassemia. Or option D, leukemia. The correct answer is option B, sickle cell anemia. Explanation. In sickle cell anemia, defective hemoglobin, HbS, causes RBCs to become crescent-shaped. Which organ produces erythropoietin? Option A, spleen. Option B, liver. Option C, kidney. Or option D, bone marrow. The correct answer is option C, kidney. Explanation. The kidney secretes erythropoietin when oxygen levels are low, stimulating RBC production in bone marrow. Which is the normal ESR value for adult women? Option A, 0 to 10 mm per hour. Option B, 0 to 20 mm per hour. Option C, 10 to 30 mm per hour. Or option D, 5 to 25 mm per hour. The correct answer is option B, 0 to 20 mm per hour. Explanation. Erythrocyte sedimentation rate is slightly higher in women than in men. Which clotting factor is also known as Christmas factor? Option A, factor 8. Option B, factor 9. Option C, factor 5. Or option D, factor 10. The correct answer is option B, factor 9. Explanation. Factor 9 deficiency causes hemophilia B, named after the first patient identified. Which WBC type increases in allergic reactions? Option A, neutrophils. Option B, monocytes. Option C, eosinophils. Or option D, basophils. The correct answer is option C, eosinophils. Explanation. Eosinophils combat parasites and increase in allergies, asthma. Which test measures the clotting ability of blood? Option A, ESR. Option B, prothrombin time. Option C, hematocrit. Or option D, MCV. The correct answer is option B, prothrombin time. Explanation. PT measures how quickly blood clots and is used to monitor warfarin therapy. In blood, the Buffy code contains option A, RBCs only. Option B, WBCs and platelets. Option C, plasma only. Or option D, all blood components. The correct answer is option B, WBC and platelets. Explanation. The Buffy coat is the thin white layer between plasma and RBCs after centrifugation. Which substance prevents blood clotting inside blood vessels? Option A, fibrin. Option B, prothrombin. Option C, heparin. Or option D, thrombin. The correct answer is option C, heparin. Explanation. Heparin is an anticoagulant produced by basophils and mast cells to prevent abnormal clotting.